Even a facility like ours, which was as prepared and as resourced as any nursing home or long-term care facility in the nation, we still had catastrophic outcomes. What I want people to know about being a healthcare worker during the pandemic is that we have given everything we have to give.
I would like people to understand that being a healthcare provider during this pandemic is like nothing any of us have ever been trained to do.
How challenging it was, how serious it was, how real it was, it still is.
We simply are providing the closest of close contact of anybody in this world at this point. We are literally in the bathrooms with people. While the rest of the world has been able to work remotely from home or been divided by plexiglass, we are literally in the bathrooms with people, which is a dangerous place. You know, often caring for people who don't understand the importance of keeping their mask on or keeping their mask above their nose. Or trying to keep space between people. I mean, the testing process it's robust. We did our first full-scale testing in May of 2020, and we had the National Guard come in to help us with that, just so we could get a sense of really what we were undertaking.
The very first test, I think all of us were pretty scared because we didn't know what was going to happen or how it was going to feel.
Ever since then, we've been on our own and have mostly been testing weekly.
It just got so much of a routine every Monday and Thursday, just going down right away, do your tests, and then get to work.
So I remember, we started, everybody had to wear masks. Wherever you went into public, you had to wear a mask. And pretty soon, St. Paul, we had eye goggles. So we had to put eye goggles over our glasses if we wore them, and I do. And that was a lot. I think I have pressure sores from behind my ears from layers of masks and glasses and goggles and earpieces to attend Zoom meetings.
I can handle the mask, but the eye shields, the goggles, that was a hardship. That was a hardship.
I think a lot of those things that we were doing were, although we were getting used to them, were ongoing reminders of what we were doing, literally in our face, that we were somewhat trapped, that we were constricted on doing what we wanted to do and what we could do for the safety of those that we served.
Well, I think at first it wasn't too bad, but as it got dragged out, like everybody was getting on everybody else's nerves.
It was kind of bad being stuck here and not being able to get out.
If I take my mask off, she seems to. But these masks just blow her mind. She doesn't understand it at all.
We, strived from early on to offer as much visitation options as we could. So by early summer, we were offering outdoor visitations, which went really well.
So I would schedule all the visits. Me and my team would schedule all the visits. I would email therapy every morning, tell them the next day who has a visit at what time so they wouldn't schedule therapy. Facilitating the visits, just making sure the environment looked clean and sanitary for the families. They were very special and very fun to do.
I remember visiting or supervising a visit with a resident who had significant dementia as well as significant hearing loss. And talking with his wife as I escorted his wife out to our outdoor visiting area, and how she really had to prepare herself for a visit like she never had to do before. Trying to understand how to best communicate with him with a mask on, with eye protection on, and at least, 6 feet in separation, how she had to still portray that love for her husband, even though she couldn't have that touch and that compassionate connection. And I remember just vividly in my mind, she held up a sign that said, "I love you." And the resident read it, and you could see the smile in his eye. So I think back to not only did we have to adapt as healthcare professionals, but our family members had to learn how to best connect with their loved ones.
One thing I appreciated from St. Paul's is that every week I got a very detailed email explaining everything that was going on here, when they had outbreaks, how they handled it, how they would took people to the isolation room, how they were looking out for people, what the COVID-19 guidelines were.
From a technological standpoint, we introduced our screening systems that people had to answer questions to in order to gain access to our building when we were doing visitations or had deliveries, just to ensure that everybody was safe. And that started off on a paper sheet and writing their names down and answering the questions. And we moved to an electronic system. It certainly helped us really modernize things, what we were doing around here.
Well, when we were first quarantined, or when the pandemic first was, when we shut the building down, people ate in their rooms. They were very lonely. Just the, that was sometimes their only connection to the outside world.
We had to stop masks for a while, and that was not easy. We had to stop all gatherings. And then when we could slowly have Mass, I was grateful that we had a priest in the villa that could have Mass here in our little villa chapel. And then at times we had somebody in the nursing home who could have Mass for us there. So the Lord certainly provided very important times for us to have that nourishment, to have that prayer time, to have that strength from the Eucharist for us.
Yeah, so interestingly, in June of 2020, we had a crisis within a crisis when we received a call at about 4:15 in the afternoon on a Thursday saying that one of our colleague facilities that we're close to had a major fire.
And at first I thought it was just a fire drill. I had no idea until I walked out of the room and the nurses were running around closing the doors. And they told me to go over to the west side of the building where the fire was. And I went over there and I just saw smoke and the sprinklers going off and everyone just running around in panic. But luckily we were able to get everyone out of the building in time.
And I'll tell you that it was amazing on the ground at the other facility to watch that team execute their emergency preparedness plan. They executed it flawlessly. There were no injuries. And it was a major fire.
I saw bus upon bus. We met in the front lobby. We prayed there first so that we were ready for our Oak Ridge residents. And there was something very powerful about that prayer that night.
I recall that we just had numerous nurses who just stepped up. And I remember each of those nurses greeting a resident as they got off the bus or one of our vans to bring them in to ensure that we did an initial assessment. I think that was really key. And the assessment wasn't just necessarily to look at how to meet their physical needs, but their psychosocial needs and their distress of losing their home, that was the home that they've known for years for some people.
I was just so incredibly impressed when I got back here later that night at about 9:30 p.m. and there were still, just dozens of off-duty staff who had responded. I think there were 75 off-duty staff members who responded to help us take in all of those residents. It was nothing short of a small miracle that we pulled off that night. So our first major outbreak in the nursing home came in mid-August, and we got the call at the wee hours of the morning that we had 4 residents test positive for COVID-19.
I think that first outbreak was more of disbelief, something that we certainly were prepared for, but we're trying to avoid at all costs.
I originally wasn't scheduled on the COVID unit, but then I realized that my partners kept being scheduled, and I knew how stressful it was for them. So I had asked to be scheduled in the COVID unit to be able to give them a break, because I know it was so overwhelming. And to top it off, we had everything from gowns to eyewear to the N95s, and then 2 people in one room, which is usually just for one person. And I mean, people were so sick.
The second outbreak that we experienced in October, I think was a bit more significant to me in the fact that it was occurred in one of our passages, memory care specific areas, recognizing that the people that were affected and tested positive with COVID in that area were people who were living with very significant dementia.
And I was assigned to the COVID unit at that time, and I can only say that staff could not have been kinder or more supportive.
Those were not easy days, but I feel the Lord was with us in it all.
I do live with a lot of heaviness in my heart as the leader of an organization that lost 31 souls. It's something that won't ever leave me.
What would you like people to remember about Lillian?
Oh, her love. She loved music. She was funny. She always kept a positive attitude in the midst of everything she was going through and getting Alzheimer's. She always stayed positive. She loved to garden. Just a sweet, sweet soul.
I always say she was very patient and unassuming. Things that people in my life hope that I am someday.
Oh, he had the most beautiful smile in my mind. His blue eyes and that beautiful smile. And even though he couldn't talk, couldn't speak, when he saw people, you could tell he recognized people. He'd grab their arm, and a lot of times he wouldn't want to let go of their hand and stuff, or he'd just smile. A lot of people always referred to him as being a very gentle person. Heard a lot of comments like that.
So we came from a strong religious family, and we tried to instill that on our children. She liked everybody and smiled at everybody and never had a cross word about anybody ever.
Passion for her family, her faith.
Well, she cared about people and especially cared about family.
My mom is the kindest, most thoughtful person that I had ever met. I think her kindness was her most endearing quality. Although she was given wonderful treatment and services here, it was very difficult for our family to not be with her, especially through the last months of her life.
So I'm from St. Fidelis Friary. We're a Capuchin Franciscan friary, and we have 5 of our Capuchins here. Father Charlie was a character. He loved to say things just to spark a response. We always called him Crazy Charlie in the province. And Paul Yarrow was more of a quiet, serious person, but still very well loved by the people who he ministered to over the years.
I am just beyond humbled and grateful that every single one of those family members of the people who we lost appreciated our efforts and knew that we did everything that we could.
I feel great. I think anything I can do to help stop this pandemic, I'll do it.
I feel really great. I think it's worth it to protect ourselves and everybody else around us.
I feel fine, and I'm grateful to have had the opportunity to receive the vaccine.
I remember during one of our incident command meetings, we had heard about the vaccine and we're hopeful about when the vaccine would be available to us. How wonderful it felt to actually see the first group of staff that were vaccinated, as well as our residents that same day, having the first group of residents and staff vaccinated. It felt like we had hope. I think that was probably the first time that I personally felt that there's hope through this pandemic, and we are going to reach it.
I thought, thank you, Lord, this is a gift from you. So many people have been praying for this. So I do. I believe it's a great gift from God to help us. It's important to do the loving thing. So to get the vaccine is the loving thing.
Oh, I tell them to definitely get it. Let's get that daggone bug out of the air.
There's appointments everywhere. There's no, now you can do walk-ins. It's not necessarily even about protecting yourself, but even just trying to curb the spread of those variants for the sake of those who can't get immunized or for those highest at risk.
Since we rolled out our vaccination program and since long-term care facilities across the nation, got their vaccine programs underway, we have seen such a drastic decrease in the number of cases and the number of deaths in long-term care facilities. And that's just, on its face, it's just evidence that the vaccine is really the only thing that we can offer that, really promises that preservation of life at this point.
What kept me strong during the pandemic, I would have to say, was our teamwork here. I think we all recognized when we each needed each other and the importance of us working together.
We were cheerleaders for each other. We supported each other, and there's no top on down to the bottom here, where everybody was pitching in.
I'll tell you the love and support and prayer that we felt from this community, from our family members, from our residents, from each other, it absolutely has kept me going and going strong.
I hope that COVID goes away eventually. I don't know if it will sooner than later, but that everyone can get along again and we can go back to resuming activities full time. We can go back on outings again, entertainment in the building. To see the past a little bit in the future would be great.
I just want to put my kind of public policy advocate hat on here for a second and remind everyone that the scrutiny that's coming our way, it's warranted, it's welcome, but we need to make sure that it's productive. Our caregivers, they are not compensated appropriately for the difficult work that they do and the difficult risks that they take. And those mandates need to continue with the recognition of the trauma that our staff have been through, because we have given our all and we're ready to do more, but it needs to be done in a compassionate way that honors the sacrifices, the great sacrifices and the great contributions that our caregivers have made to this fight.